One of the major overarching questions for this course is what specific skills do healthcare professionals need to be successful? Today we're going to begin talking about the learning goal of measuring and recording vitals, which is a major skill for healthcare professionals. Vital signs are the basic stats that we use to assess bodily functions. The main four are body temperature, pulse rate, also known as heart rate, blood pressure, and respiratory rate. But there are a lot of other measurements that are used to measure a person's overall wellness. Keep in mind that vital signs really vary by age, sex, weight, exercise, tolerance, and conditions, so it's very important for patients to know what their normal is. But vital signs are an essential part of case presentation, and this is the formal communication that healthcare professionals such as doctors, nurses, patient care techs have about a patient's clinical information. Accuracy is essential for recording vital signs. So if while you're practicing taking vitals, you forget the number in your head, and this will happen before you record it down, you should retake the vital. Never guess or report about what you remember. Accuracy is the most important part. The primary four vital signs that we are going to talk about are body temperature, pulse rate, also known as heart rate, blood pressure, and respiratory rate. Other vital signs that we might look at are pain level, pulse oximetry, pupil dilation, blood glucose levels, and patellar reflex. That's when you might remember as a kid, a doctor might have taken what looks like a little hammer and hits it at your knee. These are all used to measure how well the body is maintaining homeostasis. An organism's regulation of internal environment to maintain conditions suitable survival is homeostasis. And the key is understanding that these vital signs tell us how well this is going in our body and whether or not we're sticking in that very narrow range that is suitable for human survival. So what exactly do your cells need to maintain homeostasis? First of all, you have to recognize that cells only function in the very narrow range. And this includes temperature, pH or acidity, a concentration of oxygen and carbon dioxide, concentration of nutrients and waste products, concentration of salt, volume of water. Now, why does your body need to maintain homeostasis? Well, first of all, we are constantly being challenged. When you walked into this classroom today, it was probably cold, and the temperature of the room was outside of your normal range. So your body's constantly fighting that. Also, disease agents that might be trying to move your body outside of that set point or that normal range that's okay. However, if homeostasis is completely lost, death occurs. In fact, every death certificate you read could say cause of death is loss of homeostasis. So your body needs to maintain homeostasis so it can stay alive. Now, regulating your body is handled as your body works to try to maintain this constant internal environment, maintaining homeostasis. And there's all these different systems working together to monitor how things are going outside and inside your body. And these systems work together to try to correct anything that takes it outside of the normal range and reestablish stable conditions. It does this using negative and positive feedback mechanisms. We're going to focus on the most common negative feedback mechanisms. So when there's a change in the environment, these negative feedback mechanisms try to reverse the direction of that change. So for example, if you took a pixie stick filled with sugar, cut off the top and dumped a bunch of sugar down your throat, your body is going to recognize now the level of sugar in your blood is too high or above the normal range. In an effort to reverse the direction of that change, insulin is secreted, and that insulin is secreted by the pancreas, and it goes and it pulls that glucose out of the blood and stores it as glycogen. This will then lower the sugar level in your blood, even though it's being stored away for later, and restores the level to the normal range.